Now, KwaZulu-Natal has the third highest number of COVID-19 infections in the country. Just last night, it reported over 5,000 new infections. But now, it's likely that some of the latest numbers may actually be as a result of delayed data reaching the NICD. So, for more on the situation in KwaZulu-Natal, we're joined by the head of the KZN Health Department, Dr. Sandile Tshabalala. Thank you so much for your time, Doc, and good morning to you. I suppose let's start with, what the KZN government, health department to be more specific, actually has done or even is doing to prep for what you say is you as a province being officially in the fourth wave.
Good morning to yourself and good morning to the people viewing your program. Look, we've learned from the three waves that we've experienced as a country and as a province. And we had already repurposed beds should we need to admit people. We also had already asked for extension of the people that we had contracted to work specifically on COVID. And those contracts have been extended until March 2022. So in terms of resources, we think we are okay. We also are of the view that the fact that we never stopped to do contact tracing and advocating for the non-pharmaceutical interventions we've been doing, probably would be getting more cases should we have not stopped some of the big events that would have happened in the province, including, among others. Yes, sadly, for those that would have enjoyed the rage, you will remember that every December there is a rage opening, and we managed to discuss with the organizers. We thank them as well. We stopped that. Probably the numbers could have been higher, but we are seeing the numbers that we're seeing now. Yes, fluctuating. We saw 6,000, as you are saying, then 5,000, then 2,000. So we're fluctuating there, but we are definitely in the fourth wave now.
So, Dr. Tshabalala, with that being said and all the work that you've put in, what do you make of some of the pictures and visuals we're seeing also circulating on social media where people, of course, are frolicking in waves without any social distancing? We understand that we're in a festive season, kind of mood. People are traveling. Most people have taken leave from work. It's time for holiday. Yes, tourism industry needs the support. However, what do you make of, the visuals coming from the province, allegedly, that some seem to not be social distancing, even when it comes to beaches, that they are expected to still be packed to capacity?
Look, I think the most of the things that we attribute all that to is that people are tired of the restrictions. You also will remember that at some stage, we as a province and other provinces did report that during the times of lockdowns, the different lockdowns, we experienced a certain amount of gender-based violence, and people do not want to be locked down and not stay at home, and all the other impacts. So I think that tiredness is creeping in, or already has crept in. We attribute all this to that, but we are not thinking that people are not very, very aware of COVID-19. Messages have been sent, but also the levels of people not vaccinating. I think that is what we are trying much to talk to, so that people can vaccinate as much as possible. Yes, we are lucky. Omicron is not as virulent as we've been expecting it to be, but we're still saying a virulent or even more virulent variant come in, we may find ourselves in a problem. So we would like people to come in there and vaccinate.
We understand that when we look at districts within KwaZulu-Natal, those areas showing, the highest or the more infections are namely eThekwini, uMgungundlovu and Amajuba. But with that being said, because it's important to highlight the seriousness of, this discussion, the rate of hospitalizations in the province also increasing. Dr. Tshabalala, how are you looking in terms of capacity, admissions, ventilations, as well as, your number of patients in ICU?
Look, of the 23,000 plus people who are active cases currently in the province of KwaZulu-Natal, only about 1,300 are admitted both in the public and private sector. And that is about 6% of the people that are active. We have in the public sector more than 5,000 available beds. So we think we are okay. However, we don't want to use that to say We want to encourage people, therefore, to be reckless in terms of non-pharmaceutical interventions.
Right.
Having said that as well, we want to make sure that we rather prevent people being infected rather than have them infected and hope that when they get infected, they are going to be fine. Remember, during December, as you are saying, not only people from KwaZulu-Natal come to KwaZulu-Natal, but other people who come to KwaZulu-Natal, as it is the playground, particularly Tegwini, during holidays. People will come here from other provinces and other countries, and the infection may go up. Two, we do not know the variants they are coming with, and therefore we encourage people to still social distance and do all the non-pharmaceutical interventions that are dependent on the behavior of the people.
All right, we'll leave it there, and I appreciate you speaking to us this morning. The head of KZN Health Department, Dr. Sandile Tshabalala, thank you for your time this morning.